Welcome to the Mind Behind the Curtain podcast, a show about the stories of incredible physician entrepreneurs who've navigated the chaos, doubt, and growth that comes with creating something new. In each episode, we'll pull back the curtain on their journeys, sharing the triumphs and struggles that led them to where they are today. I'm your host, Jenny Ekstrom, a physician, entrepreneur, and mentor. Let's take this journey together. It's time to explore the mind behind the curtain. Well, welcome to today's episode of Mind Behind the Curtain podcast. I am so excited to welcome my guests, Dr. Vickie Huang and Dr. Elizabeth Casalegno. Did I say both those names correctly? I think. It is so good to have you guys both here. They are independent psychiatrists of the Adelphi Psychiatric Group in the Los Angeles area. And again, I just want to welcome you to the podcast today.
Thank you so much.
Yeah, we're so excited to be here, and just I'm always just so inspired by what you do, and it's really cool to get to talk with you.
Well, I think thank you. I think one of the most exciting things about what I get to do is to just meet physicians who are from all over the country, and every story I hear just is so inspiring, and I love to highlight them. And when I found out that the two of you were doing independent psychiatry in Los Angeles, of all places, it actually honestly blew my mind just a little bit. It feels like the place where like Kaiser reigns supreme and Medi-Cal reigns supreme. And so how can individuals come out and not only just have an independent practice, but build actually a pretty thriving one? So I love to be able to just learn from what you guys are doing and be able to share that story.
Yeah, absolutely.
I love to actually just have you guys sort of maybe lead me through your story in terms of how you met, how this idea of independent practice even came to be.
Sure. Do you want to start? You're always better at starting with these.
Well, we met in residency training at UCLA, and before any of Adelphi Psychiatric Group came about, we were very good friends. And so we used to exercise together in the resident room. We would grab meals after work, and we just spent like a ton of time together and developed a really like wonderful friendship. So that's really, I think, where things started and where our kind of knowledge of each other and trust, a really deep trust was built, which I think is really necessary if you're considering, a partnership in the business world. And so yes, that's where we started.
Yeah, no, I think it was so helpful. I think as many physicians probably can relate, when you're on call together doing 24 or 36-hour shifts and things, you really learn the best and worst of each other. And I'm so grateful that Elizabeth loves me despite my worst assets. And but yeah, so we trained at UCLA together, and we're both adult psychiatrists. I think it was kind of funny is we're obviously different people, but we're incredibly similar in a lot of ways and a lot of things.
Very similar values,
Yeah,
I would say.
similar values and principles. And I think both of us, when we were in training, I'll just speak for myself and then let you speak for yourself. I definitely did not think I was ever going to be an independent practice. I always envisioned being inpatient, probably running a high acuity unit. Maybe my dream was to be like one of my mentors, Dr. Pierre, and run a inpatient unit at the VA and have a team. And then I had the great fortune of meeting one of the most impactful mentors of mine, happened to be your mentor as well, yeah. Dr. Carol Adelstein, who was just a master psychiatrist and was my therapy mentor as a third year. And she just really shared with me like the power of psychotherapy and really being a well-rounded psychiatrist that could just treat anyone that you wanted and really be there for your patients from the get-go. And you might develop these like lifelong relationships with them. And working with her, I was like, oh, I wish I could do this and do the other stuff. And I didn't know what to do. So I was one of those people in fourth year that just like applied for everything. I knew I didn't want to keep doing training because I was done with
Done with
training.
that.
Had a lot of student loan debt and was ready to kind of make a more reasonable salary. And so I applied for everything, the VA, UCLA. Well, actually, the one I didn't apply for was UCLA because I was a little nervous about working for my mentors and not being able to say no and potentially being treated like a workhorse. So I was like, okay, I need to protect myself and looked everywhere else. And I happened to look at a couple of private practices as well. One was just a solo guy out in Calabasas, and he'd always been wanting to recruit, but never could hire anyone. And then another was also a private practice, but she had a smaller group out in Sherman Oaks area, and she had like a cash practice. What really attracted me to this other idea was this other practice was he was the first that told me you can do psychotherapy and medication and practice the way you want and take commercial insurance. And I'd never heard that before, especially in LA. The people who I looked up to and did medicine the way that I wanted to do were cash-based practices. And there's nothing wrong with that, but I think it just was something I felt was part of my value set to want to increase access to care as much as I possibly could while living like a sustainable, good living. Um, so I think at that point I was like floundering and didn't know what I wanted to do, and I kept bothering Elizabeth and be like, "Tell me what to do." And
I was also floundering, I would say, though. I mean, I investigated kind of similarly a lot of options. I did consider additional training, even though I really was eager to get out into the working world. I actually accepted a junior faculty position at UCLA, which I then later ended up declining so that I could go into private practice. Um, but yeah, I think there were a lot of opportunities. Neither Vickie nor I really had the um, I think like the full confidence to go out into solo private practice. And I think both of us also felt like that would be very lonely. And so when this opportunity came up to join this other group, that took commercial insurance and practiced psychotherapy and managed medications. That just seemed like a really attractive option. It was really kind of exactly what I think both of us were looking for, but we didn't think existed. And so I do have a lot of gratitude for our former employer for showing us that kind of model. And then, we worked with him for about 3 years and kind of learned about, the business side of medicine, which we didn't get really any exposure to as residents. And then at that point, we felt like we could take that model and maybe just do it better, quite frankly. And so we left and spun off in 2016 to start Adelpha, initially with one location in Encino, and then in 2019 we expanded to a second location in Pasadena.
That's fascinating. I love that idea of seeing somebody show you what's possible that you hadn't considered before, taking advantage of that and gleaning from that mentorship, and
Yeah.
then taking it and doing your own thing.
Yeah.
Yeah. What, sort of looking back, if you were to do things differently, is there anything that you would have done in that path, in that training space, in that mentorship space, or any lessons that you've learned that you would tell sort of your younger self?
Well, I think yes. I don't know if there's anything like major that I would do different. I think for the most part, we've kind of followed our interests and followed our values the whole way. And I think when you do that, you really can't go wrong. Uh,
Mhm.
there are more just like minor errors that we've made along the way, places where we probably, trusted some professional advisors that maybe weren't as competent as we thought they were. And then once we figured that out, we course corrected, things of that nature. And so we try to kind of share that wisdom with resident psychiatrists now. And We actually teach a private practice lecture series for all fourth year psychiatry residents at UCLA. And now we actually are teaching at USC as well, to try to give them kind of the nuts and bolts of how to start a private practice, demystify it a bit, make it seem less scary, because it really isn't that scary. It's just, it's work, and you have to put in the time and the energy, and you have to have forethought. But we figure if someone can kind of outline for them, these are the things that you need to think about, not to tell them to do it a certain way, but these are kind of the decision points, and you can go this way or that way. Here's some of the pluses and minuses of either direction. And we figured that would be quite helpful. And that was something that we certainly didn't get during residency training, which is why we really weren't prepared to do this straight out of the gate.
Yeah.
Yeah.
How did you come upon that opportunity? Was it something that you offered, or did folks from UCLA see what you were doing and say, "Hey, please come and fill this gap for our residents"?
Well, I think I'm trying to remember exactly. I mean, at that point, we were both part of the volunteer clinical faculty series at UCLA, and we were both in the teaching clinic. So we were there like a half day a week, supervising residents in a clinical capacity. And I think along the way, both of us started supervising for psychotherapy training as well. And then there was someone who sort of taught a version of this before us, but I think, and we did get a little bit of that, but it was really scary the way that it was presented. And so, if anything, I think that kind of discouraged us. And at some point, I think he was going to sort of retire from that position. And I had done like a 2 hour kind of mentorship lecture with the residents that was really well received. And then it was like, well, could you take that and kind of expand upon it? And then we ended up just taking over the private practice lecture series at that point. Yeah.
Yeah, I think a lot of one-on-one mentorship and just the residents, because I remember as a resident, it was really hard to find examples of folks in private practice, because UCLA is known to be a very research heavy and kind of cutting edge institution, which is great. But for those who aren't necessarily going to go into research or do further specialization, it leaves a little bit lacking. Like you just have to take a lot of initiative to find that mentorship.
You can find it. There's an organization called the Psychiatric Clinical Faculty Association, which is basically a bunch of volunteers who mostly do psychotherapy supervision, but supervise in other capacities as well. It's just that the vast majority of those folks were cash only psychiatrists. And so that was a great exposure, as Vickie was saying, with our mentor, Carol Edelstein. That was a great exposure to being out in private practice as a psychiatrist, but not to taking commercial insurance. We really got no exposure to that. And in fact, Carol and a number of other of our mentors thought we were completely crazy when we joined this other group. They said, "Why would you do that? You could, you can have a successful cash only practice. Why would you even bother with insurance?" And we really were kind of adamant. The one reason I really didn't want to go into private practice, probably the top reason, was that I didn't want to just treat wealthy people. And and that is, and again, there's nothing wrong with that. And those people need help as well. But we really were looking to treat working people, which is what you get when you take commercial insurance.
So tell me how you've made that work. How have you made a commercial insurance practice work while combining both the psychotherapy, which clearly takes time, along with the medication management?
Well, we don't work with all commercial insurers. So I think that's a big part of why it works. So we're selective, and it's really only the insurers with whom we can negotiate what we consider to be reasonable rates to still give us a good living and allow us to spend the time that we need to spend with our patients. Those are the ones that we work with. And so about half of our practice we're in-network providers for the patients that we see. the other half of the practice, really about another 45%, were out of network providers. So they still do have PPO insurance plans. We do courtesy billing for them so that they don't have super bills. They're not having to deal with the insurance company directly. Since we're already set up to take insurance, there's no reason we wouldn't do that. And a lot of those folks actually get great reimbursement that covers a substantial cost of their visits. And then we have maybe 5% that's
Cash.
truly cash
Yeah.
patients. And most of those folks actually also have commercial insurance, but they have HMO plans, something like Kaiser, and they don't really want to see a doctor at Kaiser. They want to see someone outside the system. And so for them, they don't get any reimbursement. They have to see us completely out of pocket. But that's more the exception.
Yeah. Yeah, that power of negotiating, understanding the value of our time and finding payers that are willing to work with that.
Right.
And then it sounds like you also, because you provide access to care, that even those folks that maybe are out of network are still recognizing the value that you provide. So those are great take home tips. So back in 2016, you guys launch out on your own. It's the two of you in one location. And then, so what's happened over the last 9 years?
Oh, it's that long.
I know, right?
We're old.
Yeah.
Okay.
Well, we put together a business plan at the beginning, kind of like a 5-year
Yeah.
plan, and we basically tried to set up the practice in a way that would make it possible to grow and to recruit other doctors to work with us. But we also had decided, like, if that didn't work out and it was just the two of us, that was fine too. But we got to a point where we had such a high volume of patient flow in, and we didn't like to turn people away because we didn't really have anywhere to send them, because we didn't know of other, at that time there really weren't any other groups that were taking commercial insurance who we thought were
Like
highly
trustworthy,
competent and
yeah.
trustworthy and would do psychotherapy and manage medications and provide like this really comprehensive outpatient psychiatric care. So we were kind of in this position of we either start turning patients away or we find other people to work with us. And especially at that time, we had a lot of adult patients whose children needed psychiatric care, and that was even harder. So actually, the first person we recruited was a child and adolescent psychiatrist, so that we could kind of follow through on this vision to treat the whole family.
Yeah, I think our path has always been, I think, driven by as good quality patient care as possible. And then that really informs a lot of our business and structural decisions and what we decide to spend our time learning. Because I think this is just, I've learned over and over again, the more I can learn about the logistics, the more power I can have to help advocate for my patients. And then as that's grown, because there's only two of us and we can only see so many people, it's like that secondary goal, which now I think is one of our primary goals, is really sharing this vision and giving great opportunities for other doctors. And I think one thing we're really kind of growing right now and trying to inspire in our staff is like, what are the things you guys really love doing that we aren't doing now? And can we help bring our operational expertise to create that vision and make it part of the services we can offer to our patients? So that's been a really kind of exciting part, right, that we're focusing on now.
Right.
So the primary care, the family physician, me has heard a couple of things that just like resonate. I love the lifelong relationships, the whole family, that sort of continuity of care. It just like makes my heart sing. And I love to see that happening in psychiatry as well. So I just want to point that out. So how has your involvement with residents changed now the environment? You mentioned when you were first starting, you guys were sort of the only folks doing the insurance-based practice. Has that changed?
Yes.
Yeah, it's so exciting.
Yeah, no, I don't want to give ourselves all of the credit here, but I do think there was that we have inspired several other groups to start in the Los Angeles area. So now we are one of several groups that provide this really excellent high quality care and take commercial insurance, and really we're all a little bit different in kind of our emphasis, but those core values are pretty similar between us. Yeah.
Yeah, and I think a lot of them were either I used to do the interpersonal psychotherapy clinic, and
Mhm.
Elizabeth was a supervisor in the psychosis clinic, and I think a lot of those people worked with us in those clinical capacities, and then just remain in our lives, and we talk all the time, and kind of just share our war stories and help build each other up. So it's just so cool to see.
Yeah, it's just, it emphasizes the power of when we see what's possible, we see what's possible, right? And so,
Modeling is so important. Yeah.
yeah, and it's why I love to highlight these stories, because then we can like see like, oh, maybe that is something that I can do. So as you're sort of looking back in your growth, what have been some of those challenges that you've faced, and maybe what have you learned from that?
Oh.
Well, I would say one of the biggest challenges was when the pandemic started, like how to deal with that, because we, to the credit of a couple of our doctors, they came to us very quickly, like
Yeah.
within the first few days when
Yeah.
I mean, it was like mid-March, and said, we really think we need to go remote. And the way our practice had been structured for prior to that was we had zero telehealth.
Yeah.
Mhm.
And so it was very difficult to sort of figure out, like, how are we going to basically move a full-time in-person practice to really 100% telehealth. And what I learned from that is what's useful about having a small group practice, in contrast to some of these bigger institutions that were much slower to respond, was that we could make decisions very rapidly. And so we initially didn't have the greatest of telehealth platforms, but we found something that
Yeah.
kind of
Good
worked
enough.
good enough. And within another month beyond that, I think we had switched to something that was very effective. And then eventually our electronic health record system started offering a telehealth platform that was fully integrated. But, I think what was useful about that was a difficult time, but we did learn to pivot very rapidly and to make rapid adjustments. And that showed me that that was something that we could do, we were capable of doing. And so when other things have come up thereafter, we don't kind of sit around waiting for stuff, something else to happen. We just make adjustments really rapidly. Yeah.
I think
Yeah.
it's great. What I was thinking for me personally, I tend to be kind of one of those more anxious people who just mulls over and just like, wait, what do we do? And then I doubt it. And then I'm like, I know what I need to do, but then I just doubt it. And I think over this, I've really learned, and you've been a huge help for me in this, and just like trust your gut, and just if it doesn't work, you just fix it. It's okay. It's not
Exactly.
the biggest deal.
We are always thorough before we make decisions, so they are well considered. But I'm not of the opinion that we need, we now have a good enough sense of kind of what we're looking for when we're looking for it. Like recently, we needed to hire an attorney to help us with an insurance issue that came up with one of our payers, and like usually we want to talk to, 3 people at least. And, but I got on the phone with this guy. I was like, no, we're done. He's perfect. He knows what he's doing. This is exactly who we needed. And he came by way of another referral that was highly trusted. So, I mean, I think we're getting to a point where we know what, we're thorough, but we also know what we need when we need it, and we can kind of make decisions more rapidly.
Like who makes good partners for us in the way we work. So it's like, oh, okay.
Yeah. So learning to trust your gut and learning what you need for your business. And then that being able to be facile and adjust. We were sort of the same thing, right? I'm in the independent practice as well, Elizabeth, and same thing. Like we had the ability to say, Monday, this is what we have to do to keep our doors open, to keep caring for patients, and to stay solvent. So how has telehealth continued in your practice once you came back to in person?
I think it's been variable across the practice. So some of our doctors have like very heavily psychotherapy oriented practices. And actually, I think those lend themselves fairly nicely
Mhm.
to the telehealth platform. And especially with Los Angeles traffic, a lot of patients have preferred to remain mostly telehealth. I treat a lot of patients with primary psychotic disorders, and many of them take a medication called clozapine. And
Hmm.
so for those patients, it's very difficult to kind of evaluate them thoroughly over a telehealth platform. So even during the pandemic, I did come in to see those patients. You know, I'd come in
Hmm.
a half day a week or something, and or one day a week and see all those folks. And so my practice is probably more like half and half, but I know some of our other doctors are still primarily doing telehealth.
Yeah.
Yeah.
Yeah. What is the most common advice that you find yourself giving those resident physicians or your colleagues that are really just starting out in their independent practices?
What?
I'll let you
No,
talk.
no, no, you go first. I want to hear you first.
I'm laughing because I
You
always
can see Vicky's smile. I love it when you smile and laugh. It's so beautiful.
I just have these really like crazy thoughts sometimes. I'm like, don't say that out loud. um, but a more tame version of it is like a version of like just trust your gut. I think even though having mentors, I think is incredibly important, and my mentors have been hugely impactful in helping me get the life that I want and do what I want. Um, it's okay to be a contrarian and just do whatever you want. Even if everyone's telling you don't know what you're doing and it sounds crazy, um, which is what we were told by people we love and trust, is like, okay, let's just try, and it's okay to fail. It's just a learning opportunity. So, yeah.
Yeah.
I think one of the things we often tell the residents when we're working with them in the private practice lecture series is there's something about the institutional setting that I think almost, I don't even, it's going to sound bad, but I don't know if if it's intentional, but they get this idea that they are just kind of a cog in the wheel and they're not very valuable and they're replaceable, and what we really try to emphasize is they have no idea how much value they have and how much expertise they have, and especially coming out of the institutions we have here in Los Angeles. They're so excellent.
Yeah.
These are really like the cream of the crop folks. And so we really do try to like emphasize that the institution has led them to underestimate their capabilities. And if they only knew, and they will understand when they have more time outside of that setting, that they're very capable and there are a lot of things that they can do that they never had imagined.
Yeah. Like dream big
Mhm.
and then you'll get it. It's hard work, but if you don't dream, then you're just stuck. And
Right.
yeah.
I mean, that 2 minutes was like a master class in entrepreneurship, right? Being willing to try and it being okay to fail and what we learned from that, knowing your value, claiming and owning your expertise and dreaming big. I mean, bam, mic drop. Oh, I am so grateful for how you are pouring into those residents as well. I mean, not only are you impacting, and again, any of those situations in medicine where we are in relationship with patients over years, we know how valuable we are to them. And I would dare I say, and I'm sure you guys may feel the same, like how valuable those relationships are to us as physicians as well. I mean, it's just such a gratifying place to be and to know that you're providing that care and to meet those needs. So when you had the parents and you said, we need to provide care for your kids, we need to make that be a place where you all can come. So we're going to facilitate that and find a provider. That is just so valuable. So thank you for the work that you guys are doing. I love it. How, if I have folks that want to connect with you, how can we find you?
Just we have a website, and also feel free to reach out to me. My email is victoria@adelphapsych.com. But just call me Vickie, otherwise I think I'm getting yelled at. So yeah.
And I'm Elizabeth@adelphapsych.com. And if they can't remember that, they can just go to the website and send
Yeah.
a note through there.
Yeah.
That works too.
We're very easy to reach.
Adelphapsych.com.
Yeah.
Yeah. And I will speak from experience. I pulled some other like residents that were in their fellowship. And Vickie, it's been great to just pull you in and have you share knowledge with them. So I would encourage anyone who's listening, who's interested in independent, specifically specialty or psychiatry, these guys are a great resource. So, well, thank you both for your time. It was such an honor to hear your story. And again, I'm just so inspired by what you guys are doing.
Thank you so much. Yeah, and thank you for your time as well.
Thank you for joining us on this episode of Mind Behind the Curtain. If you enjoyed today's episode, be sure to subscribe and leave a review wherever you listen to podcasts. And don't forget to share this with someone who needs to hear it, because often the answers we're searching for are already within us. For more inspiration and behind-the-scenes insights from amazing physician entrepreneurs, visit us at unclutteredmindmd.com or follow us on Facebook and Instagram at unclutteredmindmd. The curtain's always open.